All right. Hi, Fosters. Kayla and Dr. Lisa here again. And I wanted to touch base with you guys today on something that I think is important for the upcoming large event that we're having November 4th, our big roundup. And these dogs specifically can come with different skin conditions that I wanted to touch base with Dr. Lisa on, so to hopefully help answer any questions or concerns for you guys. These specific things are, I think, more common with this group that we see. And there are some scary things that I know a lot of fosters are worried about welcoming in their home, one being mange. But in general, we have a lot of dogs coming from rural areas that can have itchy skin.
Yep.
And there's all different reasons for this. But something I wanted to talk to you about was some examples of what we can come across and ways to keep ourselves and our pets safe at home.
Yep.
So, what is the number? I'd say, well, mange is the number one concern. So what kinds of mange can we come across, and are they all scary, and do we have to be worried about all of them?
So there's two main types of mange. You'll hear the word mange. There's demodectic mange or demodex and sarcoptic mange or sarcoptes. They're both sort of called mange. Neither of them is scary, I don't think.
No.
To be honest. But they are slightly different in the way they are, the way they present, and they used to be different in how we treat them. Actually, lately with Simparica Trio, it treats everything, which is amazing. But like I said, they'll come to us, especially again from the rural areas, with all kinds of skin issues. We see fleas, obviously. We see ticks. We will see sarcoptic mange. We'll see demodectic mange. Sometimes both of them at the same time. And we'll just see poor coats from just horrible nutrition. Again, think of these dogs who are eating probably from the junkyard or from table scraps or whatever they happen to find, or something dead on the road. Their diet is not good. And just like in people, your diet really does have an impact on your skin health and your coat health. So that's probably one of the bigger things that we're going to see in these guys. A lot of them are shepherd mixes, and so their skin is, if they're not shedding properly year to year, they're going to have buildup of dry, just uncomfortable skin. So bring them into a warm, humid home that they're not used to. They've got this thick undercoat. They've got poor nutrition. They may or may not have some skin, parasites on them, but they're probably going to be itchy. Just from the change in diet and the change in environment. So
They could be real scabby.
Really scabby, yeah. And they could have skin infections, they could have bite wounds, all kinds of things. So yes, we see fleas.
So it's not scary if you bring a dog home and it's itching a lot.
No, gosh, no.
They're also, something too I've even noticed is they're not even used to wearing collars. So
Yeah.
you get them home and they're itching like crazy, and it's like, oh,
Yeah,
it's just the collar.
And then they'll have ear infections too sometimes, that they'll itch, or they'll have so many reasons for a dog to be itchy, to be honest. But yes, talking about mange, we've got, again, like the two kinds of mange. I don't know if you can see this. I'm going to try. I found a really good picture. This is a sarcoptic mange mite. He's pretty ugly. And this is microscopic, so this is not something you'll see with your bare eyes. But it's a little bug, and they basically chew on the dead skin of an animal. And so they kind of dig around in the skin, and they chew and they run around, and they're really, 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 really itchy. For some reason, they tend to kind of be at certain locations on the dog. So the edge of the ear, the elbows, and the hocks are the areas that we'll see those mites gravitate to for whatever reason. And they live kind of on the surface of the skin. Because dogs will itch themselves, a lot of times they will actually ingest them. So when we go to try and find them on the skin, a lot of times we can't actually find the mite anymore because the dog's eaten it. Unfortunately for the dog, that bite will be really itchy for a long time after the mite's not even there anymore. So if a dog's got a couple of mites on it, he's biting them, he's getting rid of them himself, he's still going to be itchy for a long time. The other thing is those mites will actually lay eggs on the dog's skin too, and then those eggs will hatch within a few weeks and start causing more itching. It's about a 3 to 6 week period between the laying of the egg and the adult mite hatching and being itchy. So it might be something they were exposed to before they got here, and then all of a sudden they start getting itchy. Fortunately, though, because we give Simparica Trio on day 1, that will kill the mites. It doesn't kill all of them, but it's something that has been used. If you give it once a month, it will take care of these mites. So as far as the the worry about your own dogs yourself, it's not common for people to get mange from their dogs. They can, but the mite actually prefers dog skin to people skin, so it might bite a person, but then probably will leave quick because it didn't really like it too much. It wants to be on a dog. So it could bite a person and cause a little bit of itchiness, but it doesn't cause that same kind of infestation that dogs get. Kayla can tell you more about that in a second. But they also don't live off the dog. So if your dog if you have a foster dog and we think it has mange, all you have to do is treat it with a Simparica. You can give it baths and clean off the crusty areas to kind of help, loosen the skin and make it more comfortable, clean the bedding, but it's not going to be airborne or all over your house or all over your yard or anything like that.
Well, and something that's important to remember too is, especially if you're planning on helping with this, but really any foster dog and rescue, is how important it is to maintain your dog's monthly preventatives in order to help keep them protected at home. And that's something that I find comfort in and can bring dogs into my home. Is I know that all of mine are on Simparica, or before this even NexGard, and then I feel comfortable bringing in a mangy dog home, knowing that if it were sarcoptic mange, then they would already have treatment. Yeah. And that's Bravecto covers it, NexGard covers it, Simparica, Revolution. Those are all preventatives that your dog could have monthly doses of to prevent something. Not prevent it, but if they're exposed to it, us not have to worry about your dog getting these mange mites.
Yeah, and again, these dogs are coming to us without any kind of previous vet care or any kind of really good home environment. So your dog who's been in your home and is on a good diet and taken care of and is on its monthly preventatives, if it gets one bite from a mite, it's not going to end up losing all its fur, looking like Greg from last year. It's just It's going to be a little itchy maybe for a little bit, but it'll be fine.
And and something to remember too is we may have dogs come in that look pretty awful, but if they have Demodex and they have secondary skin infections, they look horrible. Right. But it doesn't mean that.
Yep, and that's really common too. And again, so then the other mite is Demodex, and this one I'll hold up again too. I don't know if I'm holding it in the right spot, but it's a smaller guy and it's a cigar-shaped little mite. This one actually lives inside the hair follicle. This one is not contagious. So this one we'll see, and these are actually normal commensal organisms of all mammals. So we have these guys too.
We do have them.
And they are passed mother to offspring through nursing and grooming. So they'll have them kind of in the skin around the face, on the paws, around the eyes are common places for Demodex to be. And they're normal. If you looked in every single hair follicle of a dog or a cat or a person, you would find them. It's just when the immune system is stressed, such as poor nutrition, living in the cold, getting transported 8 hours here, all the things that these dogs go through, their immune systems are stressed. And then these mites can actually start to overpopulate the skin. And then what happens is they start to lose those hair follicles because the hair follicles are getting crowded out by the actual mite. And with both of these guys, what's really common too is a secondary bacterial skin infection because it's itchy, it's inflamed, there's normal small amounts of bacteria on the skin, they're scratching, they're chewing, and they're introducing that bacteria deeper into the skin layers, and then it gets even more itchy because now there's an infection on top of it too. So a couple of reasons that dogs might come in looking really grungy, lack of coat, thick skin, red skin, itchy skin, and it might be mange, it might be not mange. It could be mange and fleas and ticks. It could be everything. But again, I guess the main point here is that we are on top of it. We're giving them Simparica Trio at day 1. The other thing that can help kind of reduce the numbers of both of these mites would be that lime sulfur dip, the really stinky sulfur smelling dip that we sometimes use. That can be given to a really nasty looking dog, and that will just kind of help get a lot of that crust off of them and kind of start helping the process of killing those mites more quickly. That's kind of the old-fashioned way to treat mange, so we don't have to do that anymore, which is great, but that is an adjunct that we can do. Or if you're here to pick up your dog and you're like, gosh, he looks really mangy, you can give him a bath. We have the shampoo right there.
You sure can, and I actually found 2 volunteers willing to do lime sulfur baths.
Great.
The weekend that we come back. So if we needed, added treatments, or we think it'd be beneficial to give a dog one of these baths, we do have a volunteer, but we'd love more if anybody is willing to come and do those, get some gloves on and get those stinky baths. But so I think this is good. So knowing that if you guys welcome a dog, just because it may or may not be itchy when you bring it home doesn't necessarily mean that it's a scary thing or the whole family is going to be itchy or covered in mange, and you don't need to burn anything in your front yard. It's going to be okay. In fact, I know you specifically. The whole vet team has been exposed to a whole lot of dogs with mange. I know I have my entire life, and I can say that I've actually had scabies one time a few years ago, but I'm not surprised at all by it. I was handling dogs the entire day, and didn't have time to run and wash up to my ears every single time, and it was a cream, it was managed, it was over and done with. I was itchy for about a week, and it was not the end of the world. So I guess something to come away from this is treatment is Simparica. All the dogs will be getting it. So even if they do have it, they'll be currently being treated for it when you pick them up. And things to remember at home would be cleaning bedding, doing the baths, and making sure that your own dogs have a monthly preventative. And we should be feeling pretty good with that setup. But again, let us know if you guys have any questions. If we can help ease your mind about anything, let us know. And we are so excited for November 4th to come around, and we can't wait to see all of you. All right, thanks.
Thank you.